Hi, everyone, and welcome back to Microbusinesses on a Mission Live. I know I said something about discussing business as a force of good for today, which is Giving Tuesday. However, I have a special guest today that I wanted to join me, and maybe we'll still discuss business as a force for good. So, without further ado, please welcome Shelly Cristobal. Hi, Shelly.
Hi, Emmy.
Did I
I'm
say your name right? Because it's different. I'm from the Philippines, so we say it differently. But I don't know how you say your name.
uh, I typically say Cristobal.
Oh,
My
Cristobal.
husband
Okay.
is actually from the Philippines, or his parents are from the Philippines. So we'll talk about being Filipino later. But I don't look Filipino. But yes,
This is
the,
crazy.
yeah,
Okay,
it's a
so
small world.
as everyone probably realizes by now, I don't know you very well. So whatever you say is going to be new to me. So, but that's great. Oh my goodness. So yes, please do let us know who Shelly is.
So I'm Shelly Cristobal. I'm actually from North Carolina, and my I have an audiology practice in South Durham near South Point. I took over the audiology practice about 6 years ago in 2014 from a retiring provider, and it has absolutely been my mission to use our care and management of folks who have trouble hearing as a way of connecting people and helping people stay connected to the folks who love them. And our mission statement is to recognize and honor the dignity of each individual that we encounter. And we find that communication and connection to one another is such a huge part of our perception of our own dignity. So many of the patients I work with are much older, over 80. I think my average patient age is 83. And so there's a real sense of a declining sense of one's own sense of dignity later in life. And I think staying connected to the people we love is such a huge part of that. So that's sort of our mission, our work. We also do quite a bit of hearing conservation, trying to keep ears working where we can, um, earplugs, in ear monitors, that sort of thing. But we do offer a range of services from auditory processing disorders, hearing aids, and cochlear implants when folks have a hearing loss that progresses to that point. So that's a big review of the business. I have grew up in North Carolina. I went to UNC for my undergraduate and to Memphis for graduate school. And then came back here for my internship and worked in a larger healthcare setting for a while before striking out on my own. And I think you can probably tell, but I really love the work that I do. We take care of adults of all ages, but I do really enjoy working with older adults and even folks who have dementia. There's just a really special heart to that.
Yes, no, and yeah, definitely. Oh, I don't know. Can you hear that? There's like an echo.
There's a
Um,
little, yeah.
yeah, I'm not sure. Oh, it went away. But that's wonderful. I mean, how did you fall into this field, or was it something that you always wanted to do, or did you have family members that were hard of hearing? Like, what led you down this path, I guess.
I had a really sort of long and meandering path to audiology. I went into school pre med and planning to be a pediatrician, which is almost the exact opposite of working with. I saw someone who was
Yeah.
103 yesterday. So, but as I sort of meandered and was looking for really what sort of specialty or place to focus fit me best, and then also pursuing some sort of fun classes along the way. I double majored with history. History led me to linguistics, and linguistics led me to language development.
Mhm.
And with the language development class and the anatomy and physiology of the auditory system, Melody Harrison, who's I guess emeritus faculty at UNC now, one lecture on the ear from her, and I was sold. It's just such a beautiful and complex organ. It does incredible things, a lot more than we give it credit for.
Right. I mean, we learn pretty much everything we know through the senses, right? You hear things, you see things, you feel things, you smell things. So, taking one of that and having an impaired sense, it's huge stress on people, especially if you're older and you're kind of probably losing some of the others too. So,
Right. Exactly. Well, and Helen Keller said that the loss of vision cuts you off from things. The loss of hearing cuts you off from people. So much of our communication and connectedness to people comes through our verbal communication. And those relationships are so important. I think 50% of what I do really is marriage counseling for later in marriage because
are you
communication is
serious?
such a big part of that. Oh, yeah. Oh, yeah. That's a
Hang on, hang
lot
on a
of
second. Hang
marriage
on.
counseling.
You're talking about old people having marriage problems? Oh my goodness.
Well, our communication really changes over the course of our marriages. I mean, you got to think
Yeah.
pre-kids, it's a very different scenario than with young children. Young children is very different than when you have the older kids who are, listening in and chiming in or trying to be part of the conversation. And then when kids leave home, that changes things pretty dramatically for most couples as well. And as life progresses, health concerns, change of living environment, lots of things. We're constantly evolving, and it's really sort of an honor to be able to participate in folks making those transitions as they go.
Well, I never thought of that, for your field, but that's wonderful that you have that sort of segue into from their ears to their hearts, really. Um,
Absolutely, it's a really intimate relationship
yeah.
when we're talking about somebody's communication.
You should talk to younger couples too.
That's
But yeah, so it's probably hard also on the family themselves, the hard of hearing person, but also the family that has to deal with that person who can't hear. I bet the stress is there because they get annoyed or whatever. So I bet that's something that you have to deal with and the person you're treating as well.
Tremendously. And that's when we're starting with a new patient, we like having them bring family members with them because communication isn't a one person event, it's really a relationship event. But you're so right. If one person in the house has hearing loss, everybody in the house is having some sort of communication difficulty.
Yeah.
And it's an invisible disability. It's one with a lot of
Yeah.
stigma associated
Yeah.
with it. If somebody wears glasses, nobody thinks twice about it. If somebody comes in a wheelchair, anybody's going to hold the door for them. But if you have trouble hearing and say, could you say that again? Can you say that again? Can you say that again? By the third time, people are just like, forget it.
Yeah.
Which is a big part of why hearing loss has such an increase, is associated with such an increased rate of lots of other things, but depression in particular, which with this year in our isolation, anything we can do to stay connected is really important.
Right. Well, it's funny because my mom has it. Well, sorry, Mom, I mentioned you have a hearing aid. It had Bluetooth. And
Oh
I
yeah.
was shocked because I think I was FaceTiming her. I don't remember, but so we were talking, and then she turns the phone to the camera to my dad, and he couldn't hear a thing because the speaker was in her ear.
They're wireless headphones. Hearing aids are crazy these days. I mean, we can make them. They can be a fall detector. They can be a step count. You can have your Fitbit step counter in your hearing aids.
That's so funny.
But the Bluetooth wireless is huge especially for folks with severe to profound hearing losses.
Right.
I mean, I've seen folks who hadn't been able to talk on the phone in years and years, calling their mom from my office or calling their wife from my office and being able to understand them. It's amazing.
It's right here.
Yeah, exactly.
Whoever invented Bluetooth, the hard of hearing community is probably yes.
It's amazing. Well, and the folks with the cochlear implants that will pair to their smartphones, being able to stream the phones straight into their nerves. Really, it's something super crazy sci-fi.
So they even have it better than the hearing people because they don't have to set up anything. It's already in their ear, kind of like their own, speaker. That's incredible. That's wonderful use of technology. So have you noticed if the pandemic, being in lockdown, has forced people to go online more, and is that helping, connect people more with people that they may not see as often in their family?
It's been interesting because of course the older population who I work with has been most isolated during all of this. And there's sort of a range of how people respond or handle that. I've seen some folks certainly go the direction of shutting it down and just embracing the isolation and the solitude and making the assumption that it will be a short-term situation. And of course it's not a short term, but saying, if it's a year, it's a year. When you've been around for 80 of them, 1 year doesn't worry them quite as much. We know that's not particularly good for folks, but also everybody manages in their own way. But we've seen a lot of folks really embrace the technology. That's been an interesting piece of I feel like we've worked so much harder this year because we've had to adapt in so many ways, but we can program hearing aids remotely. We can.
My goodness, smart hearing aids.
Yeah. Oh yeah. My patients can send me a note or send me an email, and I can log in remotely and send them basically like a firmware update that changes settings or adds an additional function. If when they're on FaceTime with the cousins, they scream and bounce and make so much noise that I really don't want it quite that loud, I can send them an update so that happens automatically. And we've done a lot of coaching. I have a patient care coordinator who's 23 and super cute and very patient, but native to all of this technology. And we sort of say we'll rent her out as an extra granddaughter. She'll talk you through the FaceTime, or she'll help you set up this, that, or the other, so that our patients can utilize that technology their hearing aids are capable of to its fullest extent. So that's been really sort of fun this year to be able to build new connections and learn new things and help other people learn new things.
But it's wonderful connecting young people with older people.
Yeah, absolutely.
Technology. Well, this is not your grandma's, well, your great grandma's hearing aid. This is very exciting how much you're able to do with the new generation hearing aids, I guess, and connecting people. So maybe you can just tell us and recap a little bit about the mission that you have. Why is it not your ordinary hearing health care, company or business?
Sure.
I mean, I don't know how you would call it. Is it
Yeah, we call it a practice or a clinic. And we do take a medical model of, in contrast to a lot of places where you go buy a hearing aid are retail based. They're typically owned by one of the larger hearing aid manufacturers. There's 6 major manufacturers of hearing aids in the world, really. And it's really, I work where I work. I am doing what I'm doing because we don't work for a big healthcare system where patients are numbers and employees are cogs, or providers are just sort of tools in the process. We don't work for a big hearing aid company where our job is to sell as many hearing aids as possible. As an independent practice, we work for our patients, which means if they need auditory training, which is like physical therapy for the auditory part of your brain, that's what we do with them. If they need a hearing aid, we set up a hearing aid and we take the time to follow best practices and talk them through it, coach them through the process. And if they need something more like assistive devices or a fire alarm that'll alert them with a light because they can't hear when their hearing aids are out, or if they need a system that plugs into the sound system at their assisted living community or their church, we have those extra steps to make sure that we're meeting their full hearing and communication needs rather than just sort of sticking a Band-Aid on it.
That's wonderful. Well, if I ever need your services, I'm definitely calling you.
Wonderful.
Maybe not for a few more decades, but
Yeah.
it's good to know that you guys are around. And I will get your information and add it to the description of this video below. But is there anything else that you would like to? I mean, obviously, this is microbusinesses, so you do have a small group in your practice. No
Yeah, I
more
didn't
than.
talk too much about that. So I have two
Mhm.
providers.
Okay.
One will be out on maternity leave. She's having her first somewhere around the
Oh,
end of December.
exciting.
We've had lots of
She'll be
babies.
hearing a lot of,
I've been
she'll
there
be
for
using
six
her ears a
years.
lot.
Yeah,
Uh-huh.
exactly, exactly. I've owned the practice for 6 years, and we've had four babies, all boys, among
Oh.
the staff in that time. We're all women,
Mhm.
and all moms on staff.
Mhm.
Once we're with Bretland now.
Mhm.
There's myself and Dr. Little, and then two administrative personnel. I also feel very strongly about being a living wage provider, and providing women with jobs that are family flexible. And that's not always mom, that's sometimes it's elder care or some other relationship care, but treating the people who work for me as people, that's a really important piece of the business management to me. And something I'm sort of on a mission just to prove you can do it, that you can run a sustainable business and treat people like people. And so that's a big piece of what I'm trying to do with the business side of things as well.
That's beautiful. So you're not just about serving your patients, but you're also serving the people in your practice and trying to help everyone live a richer life, right?
Exactly,
With
exactly.
relationships all around. That's wonderful. Well, I'm so glad to have met you online.
Yes.
And
One
also,
day we can meet in person.
yes, yes, not too far. And we'll probably be chatting a lot, especially after that Philippine connection.
Yes.
Thanks so much, Shelly. I'm going to provide your information again in the description below. But if anyone needs any hearing services, Shelly is around. Do you serve just North Carolina, or how does that work?
I'm primarily serve folks in North Carolina. I do have
Hmm.
a few patients who come in to see me for a few visits to get established, and then we provide remote care. So that is an option. We also have an online store, and we are offering, currently, we have things like clear masks for folks
Okay.
who have loved ones with hearing loss so that they can be safe and be seen and be heard,
Right.
as well as volume limiting headphones, particularly for
Mhm.
the kids who are on virtual school or just on screens a lot more than in the past.
Mhm.
We have earbuds and headphones with safety limiters and sort of kid colors available. And our store, virtual store, is on our website.
Okay. Well, we'll give the link to that. This is strange. I don't know. I think they know that we're dealing about hearing here, so we get all these feedback. I will get the information onto this description below, and you'll know how to contact Shelly if you have any questions or health, hearing needs. Please do keep in touch with Shelly. Thanks so
Emmy,
much,
thank you so much
Shelly.
for connecting.
Oh, you're welcome. We'll connect again.
Thanks.
Thanks, everyone, and have a good week, and we'll see you hopefully next week. All right, bye.